Hello everybody, Andrea Twarowski here with Dentalelle Tutoring. So I wanted to hop on tonight to talk about what happens if you found out that you did not pass the board exam. Okay, now I have talked about this before. I've done a couple videos on YouTube at least about what happens now if you find out you didn't pass, what happened, what do you do now, how do you study, all of that. But let me first say, please don't be too hard on yourself, okay? I don't have experience because I did pass the board exam, but when I went to hygiene school the first time, I had to take the entire program again. I was 3 weeks from graduating and my school decided to go bankrupt, or I should say the owner of the school claimed bankruptcy. So it's almost the same thing. So here I was this close, or I felt this close to being a dental hygienist, and then having my school shut down. It's like the rug is being ripped out from underneath you, literally. You're in shock, right? So if you're feeling any of those things, you might be feeling, oh my gosh, what do I do now? I found out I didn't pass. Oh my God, I can't believe this happened. How did I not pass? You felt you were this close to doing what you want to do, what you spent all your money and your hard time doing, and then realizing, oh, I have to do this again. So it's kind of the same thing. So you guys have to take the board exam again, whereas for me, I had to take the whole program again. So I do understand being shocked, feeling like you don't know what to do next, feeling like, oh my goodness, I can't tell people that I didn't pass because what are they going to say? I felt I can't tell people that my school shut down because they're just going to say, well, you should have known better, things like that. So it's almost the same thing. So I do understand. But let me tell you this, it's not you. It's not because you did not study hard enough. It's not because you are a horrible person. It's not because you will not be a dental hygienist. It's just, it was not your time to pass. It's a tough exam. That's why you have so many opportunities to pass. You do not only have one try, but you have 3 tries. For nurses, you guys, it's the same thing. They have to take the exam until they pass, but they have about 3 tries as well. But let me ask you guys a couple things. I want you guys to think of why you might not have passed, okay? Because the reasoning will make a difference. It will make a difference of how you move, I guess, forward from this, okay? So if you felt you did not pass because you didn't have enough time to take the exam and you didn't answer all of the questions, or you felt you had to hurry through the exam, then that should tell you something. So that tells you that you do need to study a little bit of everything again, but this time take your time, because last time you were probably so focused on memorizing everything that you didn't really understand fully what it was asking. So when you go to read a question that you're not used to seeing, your mind probably went blank and then you felt that you didn't know anything. So if that sounds like something that happened to you, there's still time. Just make sure this time around to study at least 3 months in advance. That's what I do say. Make sure to study at least 3 months in advance and take your time. And as you guys know, I tutor for the exam, so let me know if you need help. I have a full course called the Board Exam Prep Academy that gives you everything you need to know. It tells you what to study, when to study, and how to study, and I am always here if you have any questions. But let's say you felt that you were not successful because you just honestly didn't understand the questions. You had felt a lot of the case studies were just way over your head. You felt that the questions were just asking too many questions and you didn't really know how to focus on the answer. So you see how that's different than you just not having enough time to answer the questions. So that's you, just kind of the same thing though, is you need to study everything again and give yourself ample time to study. So at least 3 months is preferred, but that's just my opinion. And, focus on those topics that you don't quite understand first, and then really focus on the case studies, because that's where students get tripped up, because in case studies, they're not just asking you one question, they're asking you 3 questions or 4 questions or 5 questions. So if you don't understand the first part of the question, maybe you understand the second part. But if you don't understand the first part, you won't get the right answer. You might get the right answer, but the chances of it being the right answer is not very good. You know what I mean? So you have to focus more on the case studies. And again, inside my course, I do help you guys with that, because it is a skill. It takes practice. Remember the first time, I mean, you probably don't remember, but the first time you took a multiple choice test, it's different than taking a short answer test. And it takes practice to get used to knowing how to read the question, knowing how to pick apart the incorrect answers from the correct ones, you know, that kind of thing, right? So I do help you guys with that. But then let's say those 2 things don't really apply to you. You might be thinking, okay, no, I had no problems with the questions. I had no problems with the case studies. Yes, some of the case studies were hard, but I still felt I did a good job. So if you felt honestly that you did amazing and you're confused why you did not pass, then that's a little bit harder, because it just means you have to do everything the same again, and that just simply wasn't your time to pass the exam, honestly, you guys. But that also means that you might think you know certain things that you don't actually know. So as silly as that probably sounds, but you know, you might know that, let's just give an example, that a 4mm pocket means perio. But did you know that, I'm just kind of thinking this off the top of my, I'm just kind of thinking about this now to think of a question for you guys. But did you know, so okay, here's one. So let me rephrase that. So you may know that 4mm means perio, but do you know that if the patient has only one 4mm pocket, is that still considered perio? So you see how it's the same thing? You know that a 4mm pocket equals perio, right? But if there's only one at, let's say, the distal of the last tooth in the mouth, does that mean the patient has perio? You know that 4mm means perio, but then you think, well, wait a minute here. If there's only one in the entire mouth, does it mean perio? So if you had to think about that question, and the answer is yes, by the way, but if you had to think about that question, then that's telling you that certain questions easily make you second guess yourself. So even if you felt you did a great job, you might be confused with some of the questions and some of the answers. So you have to restudy everything again, but you most certainly need help from a teacher or a tutor like myself to let you know if you're on the right track, okay? It's all possible. I can help anybody. Honestly, you guys, I can help anybody. I've been tutoring since I was 19. I've owned my own business again since I was 19. I still have a 99.4% 0.4% success rate helping students pass. So I can help you. And I do understand that everybody learns differently. Everybody needs to learn in a certain way. But the main thing is that you need somebody to listen to you. You need full support. You need somebody who can give you a pep talk every once in a while and say it's okay. If this is what you want to do, if you want to be a dental hygienist, work towards it. You can do it, okay? What else was I going to say? And the nice thing is, inside of the course that I have, we go through mock exams. We go through case studies. There are tons. There are lecture videos from 2016, 2017, and there still are some, of course, for 2018. So we talk about everything. We tutor once a week unless there's holidays. We do not teach on holidays because you guys need a break too, right? But you tutor with me once a week. That is your chance to ask questions. That is my chance to test you guys every single week, to just ask you random questions. So then you can say, oh, you know what? I thought I knew that question, but the way that Andrea's asking it, I actually don't know. So now I'm really confused, you know, but this is to get you practicing and to know that you are studying the right way, because there's a right way to study and there's a wrong way, and I can help you. Don't waste time studying 6 hours a day, but just kind of looking through your textbook, looking through the notes, not knowing if you are studying the right things. I can help you. I can teach you guys exactly what to study, when to study. So at least when you're studying, you know you are studying what you have to know for the board exam. Nothing more and nothing less. So let me help you guys, because I know that need to want to be a dental hygienist. Okay, I've been there, I've done that, trust me, I know. And once you pass, it's the most amazing thing in the entire world, literally, but you have to get there. Everything, or what's that saying? Nothing worth doing. Oh, darn, now I can't think of it. Anything worth doing is worth doing well. Or everything that's worth doing, oh my gosh, now I can't think of it. This is horrible. Basically, anything that you really, really want is going to be hard work. But anything you do should be done properly. So if you're spending 6 hours a day studying, do it properly. You know, stay off your cell phone, study hard so you can pass that board exam, because you all want to pass to be dental hygienist. So let me know if you need anything. Feel free to look on the website under the Board Exam Prep Academy, read through it, see if that's something you want. Send me an email if you have any questions. You have full access to everything until you pass the exam, or up to 2 whole years, okay? So if it takes you 2 years to pass, you have full access, okay? If for some reason you take the exam after tutoring with me and you do not pass, you still have full access, no questions asked, okay? So let me know if I can help. Good luck. Try not to be too hard on yourself, because you're not the only one out there who did not pass. It's a tough exam. So thank you guys for listening. It was a little bit longer than I had intended. I apologize, but please let me know if you guys have any questions, okay? Thank you guys. Bye.